Welcome to our 5 on 5. Please be joined by Sam Engel from AllCare Health and Beth Barker-Hidalgo from the Oregon Coast Community Action, as well as the Curry Homeless Coalition. Thank you both so much for being here today.
Thank you.
Thank you.
So, Sam, let me start with you. NBC5 News is very proud to be partnering with AllCare on the new HOPE campaign about homelessness locally. What should viewers know about this campaign?
We're very happy to be working with you too. This builds on projects that we were both working on last year. You ran the So Close to Homeless program, and we were partnering with Julie Akins to do the Understanding Homelessness project. And really, it's about understanding where people are in their lives, how they reach that point, what their barriers are to moving through homelessness into housing, and how, as a community and as individuals, we can help.
Okay, and Beth, you're coming here from the coast, as I mentioned. What have you seen on the coast regarding homelessness of late?
Well, we tend to have a quite migratory population on the coast and seasonal migratory. Right now, we see a little bit of an influx as a result of weather patterns. Perhaps folks are coming over from the valley where we see more low temperatures in the evening. But overall, I would say the majority of the population that I encounter are Curry residents. They are not that migratory portion of the population. But it does happen. We do see folks that live a more nomadic lifestyle that do visit us on the coast because we do not have snow and freezing temperatures typically. So.
Okay, and Sam, you mentioned Understanding Homelessness last year and HOPE campaign now. Why is AllCare choosing to get involved in something like this?
There are a lot of reasons. Homelessness is something that affects our members. It affects hospital utilization and primary care. It affects some of our staff. One of the interviews you did last year as part of So Close to Homeless was one of our staff members who'd been homeless. We run into this in the community. When people get a better understanding of the definitions of homelessness and they start looking at marginalized housing and the circumstances that lead people to these issues, a lot of people recognize that either they have experienced periods of homelessness in their own life or a lot of their family or friends have. There's a lot that can be done to help people understand what this looks like, what the barriers are, and how people can overcome these circumstances, the resources that are already available in the community, and what some of the steps are that we can take to make more healthy, vibrant, and livable communities for everyone.
All right, we're going to take a quick commercial break. Much more in just a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Sam Engel from AllCare Health and Beth Barker-Hidalgo from the Oregon Coast Community Action, as well as the Curry Homeless Coalition. Sam, we're talking about AllCare. You guys have this large area that you cover. What kind of variation do you see, if that's the right word, in our homeless from the Rogue Valley to the coast?
So yeah, we cover Curry County and Josephine County and Jackson County. And through the interviews and some of the conversations we've had, there's a lot of differences people see. And so some of that is you've got a lot of folks that are from the Rogue Valley that have come upon hard times, and they're economically homeless. They live here, they're from here, they're struggling here to find housing here because this is where their jobs and their family are. And then you do have people that are traveling through, and you see different variations on this in the different counties. Mm-hmm.
And Beth, I'm curious, how is ORCA? How are you guys managing the homeless situation in Curry County?
Well, we're overwhelmed, of course, like most community action agencies. The population certainly outweighs the funding and or staff capacity to work with the population. But we have implemented a process called coordinated entry, and that is basically an assessment of the individuals. And as Sam mentioned, each person that you speak with is going to have their experience. And it's different from the last person that you spoke with. And
right.
So getting that deep dive into what they're going through, what they're facing, what their barriers are to safe, stable housing is part of that process, the coordinated entry assessment. And that's been underway with ORCA since about late January, February of this year. We're gathering some really rich data on the population. Depending on what their score is, will tell us what's going to be the right type of housing program that would work for this individual or this family.
Certainly a lot happening. It's good to know that.
There are.
I know it's a huge undertaking. We're so pleased that you guys are both able to be here and working with us on the HOPE campaign. Thank you so much.
Thank you.
All right. Thank you, Beth, for coming.
Thank you.
All right, stay with us. We'll be right back.